All right, hello and welcome to Trismart. My name is Bonnie Virag and I'm joined by Kelly Kuhn to bring you this free webinar. We're so excited to be talking to you. We're both physical therapists in the Pittsburgh area and we specialize in movement analysis, sports injury reduction strategies, and treatment of these injuries. I'll have Kelly introduce herself in just a second, but first let's get to our main topics for the webinar. So we'll be covering how to reduce your risk of injury as a triathlete. We'll be talking about how you can train and compete with an injury if that happens to be you. We'll discuss movement analysis for triathletes both on land and in the water. And we'll share some additional recommendations from our perspectives as physical therapists. Before we go any further, we do want to make sure that you understand that this webinar isn't a substitute for evaluation by a licensed healthcare professional. We do encourage you to get an evaluation and seek clearance from your medical provider prior to participation in any new activity or exercise.
Well, hi everyone, I'm Kelly. I have been a physical therapist since 2002, and I've spent a good portion of my career in some way, shape, or form working with athletes. And I'm also a certified strength and conditioning specialist and a performance enhancement specialist. In the last few years, I've really focused a lot with runners and doing running analysis and injury management. And I have recently opened Kelly Kuhn PT to bring running injury prevention to a telehealth platform. So everything I do is online, comes right to you in your house to make it really super convenient. And I have recently added some postpartum services to my site to help women who want to get back to running or any kind of fitness for that matter, kind of overcome some of the struggles they have. So I hope you enjoy the webinar today, and I'll hand you back to Bonnie for now. I'll see you in a bit.
Thanks, Kelly. All right, so just a little more of an introduction to me. I'm a physical therapist as well. I'm also a board certified orthopedic clinical specialist, and I'm a certified and licensed athletic trainer. I'm a performance enhancement specialist, and I'm a former competitive swimmer, but I was sidelined back in college by an injury, which is why I'm so passionate about keeping swimmers healthy. I've also coached and taught swimming lessons for pretty much as long as I can remember, ranging from really young babies to adults actually looking to overcome their fear of water. I've also had a lot of experience just working with athletes as a healthcare professional. That includes working in the NFL and at the NCAA Division I level with swimmers. I'm currently the owner of Streamline Health Pittsburgh, where I provide swimming stroke analysis, land-based movement analysis, and custom dryland programs to swimmers of all levels. So I'm really happy to be talking here with you, and let's get into some webinar information. So I wanted to dive into the swimming part of this webinar just by sharing some stats on shoulder pain in swimmers with you. So swimmer shoulder is actually just a general term that you can use for any shoulder pain or injury that a swimmer is experiencing, and it's actually really common. It affects upwards of 87% of all swimmers, and often that pain is due to swimming freestyle. So for triathletes, your main mode of swimming is using freestyle, or the front crawl, as some people might call it. So it's really important to be aware of these stats and what you can do to prevent or try to reduce your risk of injury and swimmer's shoulder. So swimming training trends are actually a really big part of what leads to swimmer's shoulder. It's not uncommon for a competitive swimmer to compete 5 to 7 days a week, the majority of their year. They can log 40 to 50,000 yards a week and up to 20,000 yards a day. So this equals thousands of shoulder revolutions per week, and that's mostly from freestyle swimming. So for triathletes, when you're training for these really long distance competitions, your freestyle stroke count for one length of the pool is actually multiplied over thousands of yards, which is a lot of volume on your shoulders. So you can see how this can put you at risk for overuse injury. Another major player that leads to shoulder injuries in swimmers are actually the physical characteristics that you can develop as a swimmer over time. Again, usually from a lot of freestyle swimming. So in freestyle, the muscles in the front of your chest are really in high demand because those are your propulsive muscles, and they work really hard and they get really strong, which also means that they often get very tight and they can pull you into this rounded shoulders, forward head posture like you can see on the right on this slide. So They also can round out your upper and mid back. They really tighten up your anterior chest wall. So like think of your pec muscles. They can limit your shoulder internal rotation, give you a lot more rotation moving outward, so external rotation. And then swimmers often have a lot of increased shoulder laxity, which can develop into instability and pain in swimmers. So these are all things that I actually take a really close look at when I offer land-based movement analyses to swimmers. And if I recognize that you're developing any of these physical characteristics or movement deficits on land, I try to address these through custom dry land programs based on your unique goals as a swimmer. All right. And the last thing that leads to swimmer's shoulder is a big one. This is your swimming technique. It's a dominant risk factor for shoulder pain because it alters the efficiency of how your joint moves each time you reach out overhead and take a stroke. So the shoulder joint's pretty complex, and if it's not moving well, there's a lot of different important structures that can become affected and injured. So let's get into technique a little bit more and break down the freestyle stroke phase. I like to think of freestyle in 3 different phases. The first one's hand entry. That's where your hand enters the water and begins the pull through. Then you have the pull through. That's that middle photo there. And that occurs below the water. And then you have your recovery above the water. So there's a lot of different technique elements during freestyle that can become flawed. And there's some research that shows that the greater number of stroke errors you have actually can lead to the development of additional errors as well as increased shoulder pain. So when I do swimming stroke analyses and watch swimmers swim, I look at their hand angle above and underwater, their hand position, their elbow position, their pull-through pattern, how they carry their head, and their body roll from side to side, as well as lots of other things. And I don't have time to get into everything that I look at, but I did want to show you a few examples of some Streamline Health Pittsburgh stroke analysis clients that have given me permission to share their photos. And it gives you a visual of what really efficient freestyle looks like versus what these stroke elements look like when there's some room for improvement. So this is the first example of a really picture-perfect fingertips first hand entry. And this is really important because it sets the swimmer up for a really efficient catch under the water. So this swimmer has a beautiful hand entry angle here. Her fingertips are pointing down towards the bottom of the pool. So that's good. This swimmer, if you look closely, is actually using a turn down thumb first hand entry. And not only is this going to reduce the stress or reduce the efficiency of her catch, it actually increases the stress to some of the structures in the front of her shoulder, and it closes down the shoulder joint on some important structures like the rotator cuff. So this puts you at risk for shoulder impingement. So in-water drills like fingertip drag can be really helpful with emphasizing a good hand entry. I'm not going to show you a video of that today, but if you happen to be one of my stroke clients, we go over these drills very carefully in detail, and I also provide videos of these drills to help you out. Next, let's check out the recovery phase. So this swimmer has a beautiful high elbow recovery phase above the water. The elbow should always be kept higher than the wrist when you're swimming above water, which is shown in this video. So I've talked to some triathletes, and some of them think that they need to swim with this straight arm recovery to get their arm up over waves and up over splashes. But a straight arm recovery actually puts your shoulder joint at risk of a lot more stress on it, and it can lead to a dropped elbow, which I'll show you on the next slide. So I always emphasize a high elbow recovery phase. So this is actually the same swimmer that you just saw. So this is a really good example of how sometimes people have asymmetries from left to right. Her right arm is beautiful. Her left arm, she's struggling a little bit more. And this is a dropped elbow above the water. So the dropped elbow actually can create increased force on your humerus and into the shoulder joint, which can lead to shoulder stress and injury if you repeat it over time. So there's a drill called thumb tracer or zipper drill that can really help to clean up this area of your stroke. It emphasizes a high elbow recovery. So if this is something that you're struggling with, that's a good drill to try out. Now let's just go underwater. When you swim in a pool, it's good to think of it because you have 180 degrees of shoulder revolution to pool beneath the water. This becomes a little different when you're in open water because you have a little bit more turbulence, but it's very important to work with the water that you have and use a really efficient underwater pull through. So in this photo, you see she's using a straight back, high elbow underwater pull, and that's ideal. Now, if you check out this swimmer, it's not uncommon to see that they are crossing their midline or crossing during their hand entry or crossing their midline when they're pulling underneath the water. So this can slow you down, it creates a lot of drag under the water, and it increases the time that your shoulder spends in the impingement position. We talked about that before. So there's a drill called the paintbrush drill. So if you imagine your fingertips to your forearm, pulling underneath the water and your fingertips being like a paintbrush painting the bottom of the pool floor. This can be really helpful when you're trying to emphasize this straight back pull through. All right, and lastly, here's the pull through from a side view. So a high elbow catch that's maintained throughout the pool is essential to producing a really strong underwater propulsion and reducing the stress that's placed on the shoulder. So this is like picture perfect, beautiful high elbow with this swimmer. But here we see a swimmer who needs a little extra practice on this. And as you can see, his elbow is dropped. That arrow is showing you where the elbow should be in the photo. And this puts him at risk for shoulder injury and pain on that side. So drills that emphasize your underwater phase, like slow motion dog paddle, can actually be really effective for improving this air and improving swimmers' feel of the water. So all of these technique elements that I've talked about and errors that I've discussed are things that I focus on and tease out in all of my stroke analysis clients. Some clients I've actually been in person, I've gone to their pool, filmed them, then come home and done the analysis. And then the beauty of the internet has been great. I've had a lot of virtual stroke analysis clients. They film it, send it to me, and then I sync it, clip it, analyze it, and send it back to them with a summary of recommendations, including some custom in-water drills. So technique is very important. All right, now let's just end the swimming portion of the webinar by looking a little bit more closely at the difference between training and competing in the pool versus swimming in open water. So in the pool, there's obviously much less splashing and turbulence, especially when there's lane lines that lessen the wake and the splash from other swimmers. And in the pool, you can rely really heavily on your flip turn and your streamline off of every turn. So if you're not familiar with streamline, that's the most hydrodynamic, efficient position that a swimmer can assume. So think of the position that swimmers use when they dive into the water or push off the wall after their flip turn. It kind of looks like an arrow or a torpedo exploding off the wall. So you don't get to use that position when you're swimming in open water. Also, we spoke about this before. You get to use the entire 180 degrees of water for your pull through when the water is still. And this definitely is something that you can use to your advantage if you're really efficient under the water. Now, if we're moving into a lake or an ocean in open water, things change a little bit. There is more splashing, there's wake, there's turbulence to deal with, and sighting becomes really important. If you're a unilateral breather and you only breathe to one side, there's a possibility that you might miss an important buoy on your other side. So for sighting, you want to be able to transition from just breathing to the side to just extending your neck. I've heard it referred to as alligator eyes, just popping your eyes up above the surface and then returning to a neutral head carrying angle and resuming your freestyle. If this is difficult for you, I really, really encourage all swimmers, regardless of if they're a triathlete or not, to become a bilateral breather. So get comfortable breathing to both sides. If someone's splashing over here, if you don't want a mouthful of water, you better be comfortable also breathing to the other side. It just kind of makes sense. And there's also some research that suggests that if you breathe only to one side, you're at higher risk to develop shoulder and neck injury or pain on the opposite side. So there's a lot of good reasons to get comfortable breathing to both sides. And then lastly, a lot of triathletes might feel that they are going to just rely on the buoyancy of their wetsuit to kind of take them from a dropped hips body positioning to raising their hips. And sure, that actually is somewhat true. The wetsuit does help you, but it doesn't mean that you shouldn't learn to kick efficiently. If you're training with the mindset that, I need to save my legs for the bike and the run, That's important, but your shoulders are going to be put under such high demand for all the laps and all the shoulder revolutions that you're using while you're training and competing. It's going to put a lot of stress on the shoulder. So my recommendation is to learn to kick efficiently, incorporate drills with and without fins in the pool, save your arms, and improve your whole triathlon swim. So wrapping up here, my top swimming recommendations for triathletes are to get a stroke analysis. There's really no substitute for mastering your technique, and it's really hard to improve yourself if you don't know what you look like when you swim. Also, work on technique drills during your training. Take time to slow things down and think about quality over quantity. Incorporate breathing to both sides, like we talked about. That will improve your stroke symmetry and help you avoid injury. And then work on improving the efficiency of your flutter kick during freestyle. This is going to improve your overall swimming and help you not just rely on your arms. And those were all things that I could also help with. So just to conclude the swimming section, I want to drive home that working on your technique and pairing that with effective dryland training can help you avoid pain and injury, reduce your instances of going to the doctors, expensive imaging like MRIs and x-rays, receiving injections, or possibly having to have surgery. It can limit your time out of the water. If you're a coach and you want to work with somebody like me, that might allow you to focus on your performance and not worry about your swimmers missing practice because of injury or illness, or injury or pain. And then a stroke analysis, incorporating that can be really helpful for your overall swimming career in the future. You can compare your stroke over time, which is a really valuable training and injury prevention tool. And the best byproduct of everything is that your overall swimming has a really good chance at improving. So thank you. I'm actually going to turn it over to Kelly, and she's going to talk about all the land-based portions of the race. Thanks.
Great job, Bonnie. That was some awesome tips there. I hope I can do as good of a job here as I go into the running and biking part of our webinar. I'm going to start with some basic injury prevention strategies that will carry over to both running and biking, and then I'll kind of move into like more running specific and biking specific at the end. So with running, I think the most important thing that we have to watch is load management. Running is just such a repetitive, high load activity that if we don't manage the load, we're at high risk of injury. So load management is basically load versus capacity. This was something that I heard from Dr. Kevin Maggs that I thought was a great way to explain it. Load is the amount of work that we are asking our body to do, and capacity is the amount of work that our body can tolerate. So if our load exceeds our capacity, we're at more risk for an injury. Kind of makes sense, like a car hits a stress point and then it breaks. The problem is we're not cars. We have a nervous system that can adapt. So our capacity can change on a day-to-day basis, which makes this actually very complex. But I'm hoping with some simple tools, we can kind of break down some of the complexity and help you understand how to keep yourself safe when you're doing these activities. So Dr. Tim Gabbett did a ton of work on this, and he came up with the acute to chronic workload ratio. Now, I don't think that most people need to go and calculate their workload, but I think if we can understand the theory, it can really help us manage running injuries or sports injuries in general, for that matter. So what they did is he divided the acute workload, which is the current training week workload, by the chronic workload, which is the work we've done an average over the past 4 weeks. And they use the rate of perceived exertion scale, which is this scale here, where the athlete can rate their intensity by using things like a breath test, like can they have a conversation, to kind of give a number to how intense the workout was. So they calculated the intensity times the minutes that they were doing the activity for to create the workload. And the ratio they came up with is 0.8 to 1.3. And it's not a perfect science, but again, the theory can teach us that obviously if we go above that 1.3, we're overtraining. So we all kind of get that overtraining can lead to injury. But where I think a lot of runners really miss is undertraining. Undertraining is actually leaves us at more risk for injury than overtraining because it lowers our capacity. So what I want runners to take home from now is I want them to make sure that when we start out that we don't take big jumps in our running programs or any training program for that matter, and that we kind of steadily progress. But more importantly, when we have an injury or we're feeling a little pain, that we don't just shut it down. A lot of times runners will just stop, do nothing, sit on the couch for 2 weeks, and then try to go back to exactly where they were. And in that time, their capacity has gone down, and then they go back to where they were and they injure. And so we get feel better, injure, feel better, injure. And so I think if we are aware of this science and we back off to what we can tolerate, whether it's a lighter run, a run walk, or even just walking, and then build back up from there, we're gonna be able to break that cycle somewhat. So how do we manage the external load for a runner? I think it's an important concept is the 80-20 rule. And that's basically that 80% of our runs should be low intensity runs. If you're a new runner, just getting distance might be high intensity for you. So you probably should just focus on working at a long, slow distance and just build up your mileage before you start adding in any high intensity training, like hill repeats, tempo runs, any kind of interval training. Once you kind of have some mileage under your belt, adding in some interval training can be really, really beneficial because it improves our overall capacity. It makes us fatigue resistant, and it can improve in performance, which is absolutely important for a lot of people. So I'm all for high intensity training. We just want to make sure that it's 20% or less of our workout, because if not, then we're really at risk for overloading. Some other things that we can do to kind of keep us from overloading is to throw in a recovery week every 4th week. Now, this doesn't mean that you don't do anything. You just want to back off a little bit. Maybe just back off distance a little bit, maybe back off intensity a little bit. You want to stay above that 0.8 in that acute to chronic workload ratio. And then the same thing, maybe every 3rd or 4th run, you just want an easier run. And that's going to help you keep from overloading. Now, the big thing that I think that runners miss is internal load. And I think this is huge in injury prevention, and we're not so great at managing this. So I think we all get that our stress, our diet, and our sleep play a role in our overall health and can contribute to injuries, but we tend not to apply it to actual running. So many people are following just standard running programs, and they'll run and they say, I've got to get the mileage in, and they get the mileage in no matter what. And what I want runners to start thinking about is, like, if you didn't sleep well the night before, or you're really, really stressed out, it may not be the best day for your longest or hardest run. You can have some flexibility with your training programs to move that run back a day to a day that works better for you. So yes, you get the mileage in, but you get it in a good way. If you have a hard time kind of policing yourself with this, you can use heart rate variability tracking to kind of give yourself an idea of what's a good day to do your hardest runs. So your heart rate variability is just the natural changes in your heart rate. And so if our heart was beating at 60 beats per minute, it's not necessarily beating like 1 beat per second. It might be 0.8 and then 1.2 and then 1.4. And I'm just making those numbers up. But the idea is that the heart rate kind of changes, and that's good. That's how our system is supposed to work. So if your heart rate variability is high, then you know you're in a good state. That's a great day for your really most intense run. If your heart rate variability is on the low end for you, you're in more of a fight or flight response, and you're more prone to an injury. That might not be the day that you do your hardest run. You still want to do something, but just back it off that day. That don't go all out. And I think a lot of runners can feel this naturally. You hear all the time, like a runner who one day goes and runs 5 miles with no issue, but then the next day a mile is really hard. And that has to do with our nervous system. So I think if we can be aware of that, we can help prevent some injuries. So we've managed load. Now, how do we build capacity? Because capacity is just as important. So this is where I come in with doing the functional screens, the movement screens, and the running analysis, all which I can do via telehealth and with the videos. And I'm going to come back to those in a minute. But some other things that managing capacity that go right hand in hand with managing load is about building the capacity of the tissues. So our bones and tendons need to be able to absorb the load of the energy when we're running and then turn that into energy to propel us forward. And that's a lot of work for those for those areas, which is why some of the biggest injuries for runners are bone stress injuries or stress fractures and tendinopathies. So it's not just about cardiovascular endurance when you start a running program, you want to build that tissue capacity. And so I want all runners to be able to tolerate 60 minutes of brisk walking before they run. If you can't tolerate that without pain, you're at high risk for an injury when you run. So some people might need to start with a real simple run at the beginning of their training season, or if it's been a really long time or they've never run before, a run-walk progression to build that load might help. And then you want to think about trying to only increase about 10% a week from there. So again, it kind of goes along with managing load. We're managing our load, but we're also building our capacity by moving slowly. And then I recommend increasing your distance before you increase intensity. We tolerate distance better, and you never want to increase both at the same time. I think most people get if you go from 5 miles to 7 miles, that's not a big change. But if you go from 5 real slow, easy miles to 7 really intense miles, that's a big difference. So you only increase one at a time, but do distance first. Okay, so let's talk about the movement screens that we do. Running is kind of a different sport because we don't really have as much technique issues because no two people move the same and no two runners will run the same. And we have to accept that. We can't expect everybody to look the same in running. So what we want to do is really understand how a runner moves so that we can build a training program that works for them. Like for example, if a runner tends to stand back on their heels, we'll often see that in their movement screen, they're on a lot of the activities, they're standing back on the heels and not using their big toe. And then during running, they're back on their heels. Well, now if I tell that runner just to push off their big toe, they're going to do all kinds of crazy things to make that happen and will create more problems. But what we can do is with our exercise, once we pull this out from our movement screen and our running analysis, we can give them the movement experience of using the big toe with their exercises. And if we program that in enough, it should carry over to their running and they'll start to use that toe a little bit more with running naturally. The other thing is what we can do is when we exercise that way, we can kind of start to build the capacity of areas that are not being trained by their running that they're not naturally using, and we can unload areas that are getting overloaded. So we can help to build resilience and capacity in tissues by developing a program that fits the runner's specific movement needs. So this is the basic screen that I use, and I learned it from Chris Johnson, who I think is of Zarin PT. He is an amazing resource for runners. I learned so much from him, so if you have time, check him out. And so this is his screen that I use, and I'm not going to get into the jumping and running in place because that's a little too advanced, and I'd rather just stick with the other stuff. So the first thing I'm going to look at is standing on one leg. Running is a single leg activity. So I'm looking for, are they wobbling? Are they leaning? And if that's happening, it's probably happening a little bit during the run, and that's just a little bit extra work that we're doing every time the foot hits the ground in a sport that's all about managing workload. The next thing we're going to do is, and I have a video here I'm going to pull up on this one, is we're going to, oh, never mind, I don't have the video. We'll just talk about it. We're going to work on a step down. So what I was doing here is I was lowering myself down on the step and then pushing back up. Okay, and I was doing it to the beat of a metronome. And that's important because running is all about absorbing shock, pushing off, absorbing, pushing off, absorbing, pushing off. And if you can do that smoothly and stay in rhythm, you're in good shape. But a lot of people can't keep the rhythm, or they're wobbling, or they have to stop, or they're kind of really unsteady with that. And that's telling me that they're not tolerating the strategy they're using. So with this exercise, I actually am not looking for perfect technique. I am looking for whatever strategy they tolerate that they can tolerate it smoothly and within repetition. Now, I may pull some things from their technique to work on, but the main thing that I want to see is that they can tolerate that activity. Kind of the same thing with the calf raise. So I'll have them do a single leg calf raise, and they can hold on with one finger, and we're just going up and down with the calf raise. And I'm looking for the same thing, smoothness and steadiness, because the calf really does absorb a large amount of load when we're running, when we go into that shock absorption. So if we can't tolerate a lot of push off with it, we're at high risk for an Achilles injury there. So I think this is an important thing to be able to tolerate. We usually say we want about 20 to 25 repetitions smoothly, depending on the age. So the next three things I'm looking at are really going to look more at how the person moves as a whole, and how, what areas they are don't have as much capacity in. We're looking with a lot of these things for breath holding, because if we're using breath holding as a strategy to get movements during these activities, well, obviously we can't breath hold when we're running. So that's going to show that we have a vulnerable spot that we should work on. So this is a bridge with a straight leg raise. And so what we're looking for is that they can kind of keep their pelvis still and hold it for about 30 seconds without kind of dropping the hips. They're not holding the breath. They're not wobbling all over, especially do they hold the breath as they push up. A lot of people will breathe at the top, but as they're pushing up, they'll hold their breath. And if they can't do this, what I would do is I would just regress it a little bit. Anything that they can't do, I would pull out and look for other things, mobility issues and weaknesses that we could work on in our program. But I would also use these as exercises, so I could pull this back a little bit to maybe a two-legged bridge, or find an easier way for them to start and build them up to it. And then the same thing with the planks here. We're looking for the same type of things. Breath holding, are they able to hold the form and keep pretty straight? Are they kind of sagging up or going down? Are they wobbling? Can they hold it for the full 30 seconds? And it's same thing here. Just because somebody can't do this doesn't mean I'm not going to let them run. I'm just going to say, okay, this is an area that we can build on to build your capacity. And I will tease out some things that I think might be causing it, but also I might start them up higher, like on a wall or a raised surface, and then build them back down to the plank. So that's kind of the basics of the movement screen and how I start to use it to help to make an individual plan. But I always like to see a runner run and see if what I'm seeing when they move actually ties into the running, because sometimes it does and sometimes it doesn't. So I'm going to look at a whole bunch of things here with running. Probably the biggest hot topic for running is foot strike and how we're striking the ground. And you know, heel striking got a really bad rap there for a while, but we know there's no research to support any one strike pattern over another. So there's no benefit to heel, mid, or forefoot striking over another. And a lot of runners will change at different points in the run, and a lot of very elite runners do heel strike at least at some point in their run. So we shouldn't be afraid of heel striking. What we think is more the issue is how far the foot hits out in front of the body. If you see here on the first picture, this runner is landing with her foot really far out in front of her body. And so what happens is when she goes to absorb the load, she in effect goes into like a single leg squat. Well, it's almost impossible to single leg squat with the foot really far out in front of you. So she has to decelerate herself, pull herself over the foot, and then lower down. A lot of extra workload in a sport that's all about managing workload. So what did I do with her? I just took I figured out her cadence or her steps per minute, and I increased it by 5% instead of metronome to that number. So I think she was at like 172. And I had her run to the beat of the metronome. And if you can see, when she was able to match up her feet, her right foot pulled naturally just right underneath her. So she didn't have to think about it. It just happened naturally, which is what we want to happen with runners. And so I wouldn't have her run with that metronome for every run, but it's something that we would kind of program into her training program, depending on her individual needs. The next thing I would look at is arm swing. And arm swing is very, very important for us to be able to transfer energy from the rotation of the upper body down to the lower body to help us propel ourselves forward. So if you see here, she's kind of swinging with her arms out to the side, which would indicate that she's using her arms more and less of her trunk to get that rotation. Now, a lot of coaches will cue their runners just to keep their arms swinging in tight. And if you cue a runner to pull their arms in tight and they're using their arms to rotate and they don't know how to rotate through their upper back, you just took away their strategy and now they have a problem. So you don't want to force the one size fits all. What you want to see is if you can give them a movement experience that might help them find a better strategy that works for them. So what I had this runner do was just to run with her hands over her head, just behind her head like this, for 1 minute. And what that did is it gave her the feeling of what it felt like to run through with that motion. And then I told her, put your arms down, don't think about anything, just run. And if you see, her arm swing naturally improved there. So what we would probably do for her is just throw this into her warm-up. Now this won't work for everybody. Some people will need to actually work on rotation first to see if they can gain the motion because they've lost it and then use that drill. But for her, that worked right away. So other things I'll look at is the loading patterns, what happens when the foot hits the ground. And you can see her hip drops a little bit here. But when I teased this out and combined with her step down, she was pretty solid and smooth. So she she was tolerating her pattern. So I wasn't too concerned about it, but it is something we'll address with her exercise program to see if we can clean that up a little bit, but I'm not going to force it with her run. And then we'll look at the toe off. And as I said, so many people tend to stand with their weight back on their heels and kind of lose the big toe when they're running. So, and the big toe is really important to give us to have a big stable base for us when we're absorbing load, but then also to kind of give us a rigid lever to push off of and when we propel forward. So if we don't have that big toe, we might be using a little extra workload in some other areas. So I would just program into their exercise program lots of things to give them the ability to feel that big toe moving and hope that they start to use that strategy when they're running. I would never tell a runner just to push off their big toe, as I said before. So those are basically the things that I would look at, and then we'd tease out some things to look for specific causes for any deviations we see and develop the runner's program from that. And I think that's the most important thing to think about with running is that no two runners are the same, and you really have to look at the whole runner. You know, we're all on these standard running programs, and I just want runners to feel free to change it to make it work for them a little bit. It's a great start, but you've got to mix it up, make your running program work for you, make sure your strength training program works for you, and understand how you move as a runner, and don't force yourself to run in a way that is like textbook. You have to work with what you have. So then from there, I'm going to move into biking. Okay. I think a lot of the same concepts from running about load management apply absolutely to biking. But now we have this big piece of equipment that we have to deal with. So we've got to take the bike into account. Okay. So the first thing we want to talk about is the aero versus power. So is it better to have an aerodynamic setup or a power setup? So what the research is telling us is that under 11 miles per hour, aerodynamics really don't make an impact. So you don't really want to worry about them if you're going really slow. At around 25 miles per hour, they do make some of an impact, but probably not enough to sacrifice power. And not till we get to about 30 miles per hour is it really maybe worth it to go into a little bit more of an aerodynamic impact. So you'd have to be kind of at 30 miles per hour for your entire race for it to be worth it. So not that it's not important at all, but I think for the purposes of this webinar, I'm going to focus more on a power setup, because I think that for the average triathlete, we're going to do better if we have a power setup where we're to prevent injury and get us the best time we can get safely. So we're going to look at how to set up the seat height, the seat fore aft, so how far back the seat is, and the handlebar height. There's some other things we can play with that I felt were a little too complex for this webinar, but you can also change the width of the pedals. But I felt we would just start with this topic for now. So setting your seat height should be determined by the bend in your knee. The most important thing is that you want the pedal to be exactly at 6 o'clock. So right at the bottom, as you see where I have the pedal in the picture there, a lot of bikers will set their foot will actually be at 5 o'clock, and they look and think they're straight down. So they're setting it with the pedal up a little bit. So we want about a 20 to 45 degree knee bend. And again, there's some variability in there for different knee types and body types. So the average is about a 30 degree knee bend, but you can play with it a little bit with the pedal at the bottom. You also want to make sure that in that position, you're able to keep neutral dorsiflexion so that the foot is completely straight, not pointed down or up, but most times we'll see people point it down. And the reason for that is when we're straight, we can actually push into our heels and get our glutes involved. And our glutes are a big power muscle. So we want those working when we're riding, okay? So if we're pointing down, we take away some of their power and we're not getting as much in our push when we're riding, when we're cycling through. Okay, so the seat fore aft, so how far or back the seat is. And I'm just gonna skip right to my pictures on this. Basically, you want to use the knee to kind of just determine how far back you want the seat. So there's the pedal spindle, the little bar in the middle of the pedal. The furthest back you would want your seat would be to have the kneecap kind of lined straight up with that pedal spindle, okay? Now this is great for somebody who's having some knee pain, because if you pull back a little bit, you take a little load off the knee. So it's a way to, and you may not do this forever, but maybe while you're nursing a knee injury, you can pull it back a little bit and just take a little stress off it and give it a little break. It's also really good for going up for a hillier course, because it gives you a little more power sitting back into those glutes so that you can really get a good push uphill. Probably the neutral, or the easiest, the one that might be a good place to start and try out, is to have the tibial tubercle, which is the little bump just below the kneecap, lined up with the pedal spindle. So that's kind of our average position. And then if we wanted to come up a little closer, we would actually line the fibular head, which is the little bone kind of on the back of the calf on the outside, just kind of below into the outside of the knee. There's a little bump there. That's your fibular head. And this position would put a little more load on the knee, but what it would be good for is somebody who's having like IT band pain or lateral leg pain, because that we know is often caused by irritated by the repetitive hip flexion. So we get a little less hip flexion in this position. So that would be a good way to set up if you're having that type of pain. And it's also good for a flatter course because you're not flexing as much, you can turn over a little faster because you don't need as much power. So you can play with it, and you can change your seat at times based on injuries that you're having. Okay, the handlebar height should be determined by how the position of your back and your arms. So if we remember back when I showed the picture of the plank and the arms are down on the floor in front of you, it's really hard to plank with your arms out in front of you. You want them basically right underneath you. So you want your arms pretty much in the same position as if you were doing a plank. So you could try a plank and then kind of try to keep that same angle. So it's basically like an elbow to torso angle of about 90 degrees. And then we can use a hip hinge test to kind of get our back in the right position. So this is the hip hinge here. And basically this is a great exercise for bikers because you can kind of practice leaning forward at the hips and not rounding in the spine. And we don't want to round through that back, one, because it's probably really uncomfortable to ride like that for a long time. But two, when we round under, we take those glutes out. And remember, those glutes are our big workhorse. We want them to work. So we don't want to pull them out of the equation. So what you can do is just kind of put a dowel or a broomstick along your back with your head and your back kind of flush on it, and work on keeping yourself flush against that dowel as you hinge forward and back. And I didn't show it in the picture, but you can actually do the same thing on the bike if you have a stationary trainer, and just kind of get used to hinging on the bike and then set your handlebars in a position where you're able to keep that broomstick flush. Okay. I think for the average triathlete, you're probably better with the handlebars up a little bit. It's really hard to get really down low and keep that good position. Now, if you're going super fast and you want an aerodynamic position, then we'd allow a little more rounding in the back. But I think for most of us, we're going to be better with a flatter back and with the handlebars raised up a little bit. Okay, so now that we have our bikes kind of set up, what you would probably want to have a movement screen for biking too. So what are some of the physical requirements that are needed for biking? Is one is enough hip flexion range of motion. As you can see on the bike here, I'm leaning off to the side to make room for my hip to come through. That's what you would see with somebody who's doesn't have enough hip flexion. We really want that trunk area to stay relatively still and the legs just to move under a stable base. So if we have to lean, that's a lot of extra work for us. We actually don't go into full hip extension, but we want enough hip extension that we can keep ourselves in a good position without having the hip flexor pull us into a curve in our low back, because that can create some back pain as we go a little bit. Ankle dorsiflexion. So again, this motion, we need to have at least enough that we can stay neutral through the whole cycle so we can keep those glutes working, okay? If you can't get your foot in that position, you can't get into your glutes, and that's important. But I think one of the most important thing for bikers is core and abdominal stability. And here's a good test for that. And there's 3 levels of it, but this level is level 3 is the minimum that we need. So in this test, I'm keeping my core kind of in a neutral position with my back relatively flat, and I'm breathing, and I have my left leg held up, and I'm lowering my right leg without letting anything move. So level 3A would be keeping the right leg up and the right leg bent, and level 3B would be doing a straight leg raise. This would be the minimum amount of strength that I think that we need to be able to keep a pretty good core on the bike. So we can go ahead and do this on the bike. And so I do have a picture of this one. So you can see here, I'm just kind of now, I put my bike up against the wall. If you do this and you have a trainer, just be safe about it. I don't want any bikes falling on anybody, but I'm trying to keep my core still. There you go. I showed how I was moving a little bit to show a not stable core, and then keeping it still as we pedal and breathing so that we can get used to the the motion actually on the bike, because things that we do on land may be very different on the bike. So we want to kind of put it on the bike. And then another exercise that we like to use in physical therapy is the good old bird dog, where we keep the core really still and we move one arm and one leg. It's a great exercise for kind of the kinetic chain motions. And here we can do this, and I have a video here too on the bike. And you can see here, I'm kind of pedaling. I have one arm back, then I pull the other arm back, trying to keep the core still. And then we'll take one leg off. You can see I lose it a little bit. When that one leg comes off, I move a little bit. I'm not clipped in here, so it took me a second. This is also a good exercise to practice clipping in and clipping out, which is important to prevent injuries. You want to be able to clip out fast in case you fall. And then, and just move to the leg. So you can work on that on a stationary trainer to get used to keeping the core still while you're pedaling there. So the take-home points from running and biking. Obviously, I want everybody to think about managing their load and building their capacity. And I think understanding your movement is a huge part of that, especially for runners. I think that they need to understand their individual movement patterns and not try to fit themselves in a one-size-fits-all. And I think a movement screen and a running analysis can really help a runner figure that out. And I think cyclists need to kind of think about what they're doing on land and how they can convert it to the bike, because you want to make sure that it carries over from land to bike. So that's kind of our wrap up on the webinar here. And if you have any questions, please don't hesitate to reach out to us. I know we kind of went through a lot here. Here's all of our information. So we have, my website is kellykuhnpt.com, and you can get to Bonnie at streamlinehealthpgh.com, and our emails are right there. So please ask us questions. We'd love to talk to people. And here, follow along with us on social media. We both put up lots of content that can help you along your training way. And it's another great way to kind of ask us some questions and get in touch with us. And I just wanted to give us a quick look at our references to give a nod to all the people that taught us all this good stuff along the way. So we just, lot to go through. I won't go through them individually. One that I wanted to point out that I didn't specifically mention was the Run Chat Live podcast, because I pulled a lot of my stuff and found a lot of the content from listening to that podcast. So I just wanted to give it a little special nod. And that's kind of the end of it. Is there anything you'd like to end with, Bonnie?
No, just Kelly, that was great. I learned a lot myself. So yeah, get in touch with us. And this was really fun for us to get together and have a chance to speak to all of you triathletes, swimmers, runners, and cyclists out there. So thanks.
All right. Thanks, everybody.
Bye.